Hi, it's Salme from Kyoui Oral Care, and today we're going to talk about how often you should replace your toothbrush or your head replacement if you own an electric toothbrush. It is important to change your toothbrush because bacteria from your mouth and from your bathroom can accumulate on your bristles. It could affect your dental health and spread infection. Also, if you have frayed bristles, it could damage your gums and it wouldn't be as effective to remove plaque. If you have been sick, it is better for you to replace your toothbrush to stop bacteria from spreading and avoid a possible reinfection. Also, you could ingest unwanted particles if your toothbrush is placed near a toilet. So the question is, how often should you replace your toothbrush? Considering you're brushing your teeth twice a day, 2 minutes per session, professionals recommend changing your toothbrush every 3 months. The American Dental Association recommends to change your toothbrush every 3 to 4 months or sooner if your bristles are frayed. So now that you change your toothbrush, how to take care of your toothbrush? If you are sharing your bathroom, make sure that your toothbrush head is not touching another toothbrush head. After brushing your teeth, rinse your toothbrush with tap water and place it in an upright position and let it air dry. You don't need a special closed container as it will encourage mold to grow or bacteria to spread. When traveling, be sure to cover your toothbrush to protect it and reduce the spread of germs. You could also store your toothbrush in a small cup of hydrogen peroxide overnight. Remove and rinse your toothbrush the next morning. If you can't remember when you last ordered your head replacement, Kyoui will do it for you. You only need to subscribe. You will get 10% off and free shipping.